Welcome back, everyone. Hormone imbalance can happen to both men and women.
Here to talk more about that is Rejuve's hormone replacement therapist, Charmaine English. Welcome back to the show, Charmaine.
Thank you. Thanks for having me.
So give us kind of just the lowdown, if you will, about hormone replacement from the standpoint of everyone's kind of normal to a certain age, and then you start to see it die off at certain ages, right?
Yeah, so kind of the criteria for bioidentical hormone replacement therapy would be 35 years old and done with kids for men and women. And there's two ways to look at bioidentical hormone replacement therapy. Would be to kind of mitigate symptoms of just general aging, low libido, lack of energy, everything from skin sag to disease prevention. The way really to use bioidentical hormone replacement therapy is for anti-aging. So any one of the big anti-aging clinics in the world, including us, uses bioidentical hormone replacement therapy basically to solidify you in time at the age of 35 or 30 or 40. So we really can bring your hormone panel back to that age and keep you there, or keep you there if you get in early enough. And then what you get with that is you get the hormone panel that you had when you were 30 years old, and all of the good things that go along with that.
Oh, I love that idea. What does it entail, though? I mean, how do you get started?
Yeah, so bioidentical hormone replacement therapy would be, starts out with a consult. You can come and see me to see if you're a candidate, and then you would move on to our nurse practitioner, Casey. And so this is all she does for us in our new body clinic is hormone replacement therapy. She books out about 6 weeks, if that gives you an idea of how kind of busy we are with that. And that once people do it and you realize how good you feel, you never want to not. You know, it's just a really youthful feeling. So after you meet with Casey, the actual hormone insertion is a pellet that's the size of a half of a grain of rice. And so it's a Novocaine needle into your hip, and then she inserts those pellets into that little incision. It doesn't even need a stitch, it's just a steri strip over the top. And so it's a 15-minute office procedure. Those hormones then get released over the course of about 3 to 4 months. So you would come back for your pellet insertion 3 to 4 times a year. So we do blood tests before, blood tests after, and throughout, so that we're monitoring where you're at.
You said you feel great. I mean, what are some of the benefits afterwards that people say they notice?
Yep, great question. So the first one is energy levels. It's the I'm doing my laundry at 11:30 at night and I don't know why I'm doing my laundry at 11:30 at night. And it sounds kind of hoaxy to say that, but that is exactly what our men and women say, is first that energy levels skyrocket, kind of the brain fog, foggy thinking that can come along with aging. That's the second thing that starts to lift, and that really is because of testosterone replacement therapy. So the link between testosterone replacement therapy and the decrease of dementia and Alzheimer's is really interesting, probably a topic for another conversation. But so the brain, I mean, it really does help with your memory, your thinking. Men will report a lot of focus, the ability to focus for longer on a task. Increased libido is kind of the third one that people will say is the next to come along. With a caveat there, no amount of hormones is going to make you want to have sex with someone you don't want to have sex with. So there's a little bit of that conversation to be had when someone comes in and that's really what they're interested in, is kind of bringing that back.
Interesting.
So let's say you're like 60. Can you still come in and get this done? Does it take you back then to your 30s and 40s?
You can. We have a lot of women in their 60s who've been struggling with menopausal, postmenopausal symptoms for decades. And after they do bioidenticals, here's exactly what they'll say. Why didn't someone tell me sooner? How come my doctor didn't tell me about this? How come more people don't know about it? And so I've been sending my clients out to Minneapolis, to Phoenix, to Denver, to Chicago for almost 15 years to get bioidenticals done this way. And more locally here in town, we have some modalities, but not pellet therapy until now. And pellet therapy really is the way to do it, because it's the way hormones are made, which is made to be absorbed, which is absorption and secretion, not transdermal, you know, through the skin. So blood hormone levels come up within 3 to 5 days. You can literally start feeling better. And so yes, for a woman in her 60s that has fatigue, insomnia, hot flashes, night sweats, foggy thinking, memory loss, low libido, all of those things, that's the ideal candidate because she feels so much different after.
And so is it very specialized to individuals? I mean, I wouldn't imagine that I would get the same therapy as you know, the next woman? Or
it's very specialized. So we take a look at a panel hormone level for you and decide if it's just testosterone, decide if it's testosterone and estradiol, or progesterone too, or perhaps just progesterone. For men, it's more straightforward. It's just testosterone, like 100% identical to what you've always had all along. Nothing synthetic, nothing that's foreign to your body. So we know how your body's going to react because you already have had this since the day, you know, that you were born, or since puberty anyway. So it's basically just pulling you back in time and holding you there.
Wow. Any drawbacks? Anything that someone should be aware of as they go about going through the consult? Or
yeah, so we have you fill out a health history that's about 100 questions and rule out anything that would make you not a good candidate for this. So there's a couple of things for women, very few things for men. So if you're interested, it starts out with a consult so that we can kind of check those boxes and make sure that you're a good candidate for it.
And how do people get a hold of you or start this process?
So best way is just to call Rejuve at 356-SKIN.
Okay.
356-SKIN. You can see it there at the bottom of your screen. Give her a call. It sounds like the fountain of youth. So
It does.
great
If
to have
there
you
was
here.
one, this is it, for sure.
Thanks, Charmaine.
Yeah,
Appreciate
thank
it.
you.
All right, stay with us. We're going to wrap things up right after this.